the Ghana Association of Medical Laboratory Scientists is calling for standardization, continuous investment and political commitment to malaria control and prevention. Now, whilst the association acknowledges the effort of government in this regard, it is however urgent the use of innovation to extinguish malaria. Here are details of a statement they released in which they make these demands. And so we have that statement on your screen there by the Ghana Association of Medical Laboratory Scientists. It says that on the World Malaria Day, medical laboratory is vital. On this occasion of World Malaria Day 2022, with harness innovation to reduce the malaria disease burden and save lives, the Ghana Association of Medical Laboratory Scientists wishes to highlight the need for continued investment, standardization, and sustained political commitment for malaria prevention and control in Ghana. So they go ahead to make some 4 demands. The first, they're calling for standardization of materials needed for quality work in diagnosis of malaria in health facilities, especially in Gemsa stain, the main reagent for malaria gold standard testing. Posits that malaria microscopy gold standard test is a skill that laboratory scientists go through further training to acquire. The profession recommends that the use of competent malaria microscopists for quality and accurate results. Also, competent people are equally required to carry out point of care testing for diagnosis. Requires that testing for malaria should be done before treating patients to avoid wastage. And the 4th and final point encourages government and the international community to take steps to make the malaria vaccine available to the target population. Let's go on to Zoom now and speak to the Public Relations Officer of the Association, Dennis Edu-Chesi. Thank you very much, sir, for your time here on Joy News Prime. Now, it is interesting that after many years of fighting malaria, we still have challenges with standardization. How is that? And you talk about 2 phases, the quality of the diagnosis and also with the professionals. Let's start with the quality of the diagnosis, the equipment and the facility.
Yeah, thank you very much, Janet. And my greetings to your cherished listeners, particularly lab scientists, for the role they play with malaria diagnosis. The point must be made that a lot has gone into malaria control as far as Ghana is concerned. And some of us have been role players. In fact, I've been part of the guidelines for malaria diagnosis in Ghana. And the recent review that we are bringing out, the latest version, I was actually part of it. So a lot has gone into malaria control. And it is not a point that we have not had enough done with regards to standards and whatever we require to probably make the requirement and to be able to successfully combat the disease. But the point is, if we want to rank diseases that are responsible for the mortalities that we are recording in Ghana, particularly if we go into children less than 10 years, 5 years, malaria, if not ranked first, will be among the first 3. So that suggests that with all the efforts that we are making, we still need to up our game. We have to raise the levels of the battles that we are fighting so that we will be able to match the disease boot for boot. I've heard someone say that if we have even committed about half of the effort and everything and all the commitment that we see around from governors through professionals to even the general public, as was done for COVID with malaria, probably for the many years that we've been battling with malaria, we would have had it gone down as much as possible.
Just to simplify it and make it easy for people to understand the issue of standardization that you raised, on a scale of, say, 1 to 10, how would you put the quality of the diagnosis we do and also the quality of the health professionals that we have to undertake these tests?
So, quality of health professionals, I can say that without any miss of words, we are having 100%, because I mentioned in the statement that training has been great. The National Malaria Control has done very well with training professionals, making them competent, and then of malaria microscopists who are WHO certified. In fact, 6 of them are at level 1. And these are people who attend the malaria certification in Kenya, and they come out or they go over there and school their facilitators. So in that regard, we tend to have great experts who are doing the work. But you see, the point is, it's not just about having professionals. It goes with logistics. It goes with consumables. And that is why in this same statement, we commended the National Malaria Control for the effort they've made last year alone, giving over 800 microscopes to the various lab facilities that we have around to help with diagnosis. But having said that, if you get blood from somebody to go and do diagnosis for malaria, you need certain stains. The stains that you are using to prepare, or chemicals in the ordinary parlance that you have to mix with the blood, so that if the parasites are there, they will be revealed under the microscope. These chemicals, one of it is what we call the GIMSA stain. GIMSA stain is basically a stain that has been developed that any part of the malaria parasite, if it's in the blood of infected people, once we prepare it according to standard, it will be revealed. But somebody can see a GIMSA and it appears like Johnson violet. Somebody can see a GIMSA and it's another grade of blue coloration. All we are calling for now is that why can't we get standards in such a way that whatever we bring into the country, wherever I sit in the country, I'm going to get the same and equal amount of whatever chemicals I need to prepare the stains, because it's out of that you can get quality diagnosis. So that is what we lack at the moment, because we don't have a standard procedure for what kind of GIMSA can come into the country. And that is why we are calling for such, because such will help us to improve our processes of diagnosis.
Mr. Agency, we'll have to leave it here because of time. I'm grateful that you could join us. That's the Public Relations Officer of the Ghana Association of Medical Laboratory Scientists. You're watching Joy News Prime.